My name is Jessica Hubbard, and I am a married mother of 2 teenage daughters, and I currently reside in the Chicagoland area. I have been a critical care registered nurse for over 11 years, and I've worked in the hospital setting for about 13. My current role as a nurse is in emergency room administration. I am the stroke coordinator for a large hospital that provides care to patients in Northwest Indiana and the south suburbs of Chicago. And while I no longer do direct patient care, I am still rounding on all patients that have a diagnosis of CVA. I provide community education and strive to interact as much as possible with my community to teach them about the signs and symptoms of stroke, risk factors and comorbidities, and activation of emergency medical services. I am also responsible for maintaining our accreditation as a primary stroke center and ensuring compliance with HVAP and core measures. I do continual chart audits, data extraction and mining, metrics analysis, and create hospital policies regarding stroke care and protocol. I utilize evidence-based practice to create policies, and I'm part of various hospital committees that work continually to provide quality patient care and the safest environment for our community. I am also a CASA, which is a volunteer court-appointed special advocate for children who are removed from their homes due to abuse and neglect. And my public health contribution for my community is to provide a voice for these children. I go to court and speak on their behalf to ensure their safety and wellness. And I am reading this, I'm sorry. While many registered nurses obtain their master's in nursing or get advanced practice degrees, I have chosen a somewhat different path in obtaining a master's in public health. I feel that I can only do so much as a bedside nurse, and I truly want to make a difference on a higher level, and that can only be achieved with advancing degrees. The area of public health that I am most passionate about is infectious disease, pathogens, and epidemiology. I have an insatiable curiosity about diseases and their processes, and the more rare and voracious the disease, the more engrossed and immersed I become in it. My goal in this field is to work on a governmental or international level of infection control. I would love to travel to remote areas and provide care for vulnerable populations. And being a nurse, I would be able to provide certain direct care when need be. The history and foundation of public health as it relates to my special interests is evolving continuously. Hand washing 150 years ago wasn't even widely recognized as a way to decrease pathogens and diseases. And Dr. Semmelweis, who pioneered hand washing, was viewed as a lunatic for suggesting this type of practice. And we have come so far in decreasing the spread of disease with the use of antibiotics, antivirals, vaccinations, aseptic techniques, the list goes on and on. I think what I find most interesting about public health is how broad that term is. We're utilizing tools, phone apps, research studies, and best practice in our activities of daily living, and some of us aren't even aware. I think what the public likes to see is results, and most people want to live long, healthy lives, and if the data and science can show them ways to improve their lives, most people are on board with that. Everyone should be entitled to clean water, vaccinations, safe food products, safe environment, quality care, and access to medical care. Those are some of the principles of public health that we are always finding ways to improve upon, and I hope to contribute greatly to this ever-evolving practice. I look forward to meeting all of you, and I wish everyone great success, and I'm sure I'm not the only one who feels that this recording is somewhat awkward, and watching a YouTube video of myself is something I've never done before. So you're not alone if you feel that way, and I look forward to meeting everyone. Thanks.